all of the US. So a drop of infections in New York City could predict a drop of infections for the rest of the country. Nationwide, trends also appear to be dropping, but it sounds like in Nigeria and other cases in other countries in Africa, they actually may be rising. So this is a spread of which gender gets monkeypox. Right now, men, especially men who have sex with men, are having the brunt of the infection. But as Dr. Achebe said, it is not a classically infection that can only infect men. Anyone who has contact with someone with monkeypox, either sexually or even having contact of clothing, you are susceptible of getting monkeypox. So a little bit about the vaccines. On June 28th, the US established a national monkeypox vaccine strategy, which includes several federal agencies, including the FDA, NIH, and CDC. On July 15th, over 2.5 million vials of vaccine were manufactured with the hopes of being distributed. And on August 9th, the FDA established an emergency use authorization to actually use a smaller dose of the Janus vaccine and administer it in the forearm instead of the biceps, because they're using a smaller dose where they're hoping that more people can be vaccinated. Vaccination with the vaccinia-virus, or the smallpox vaccine, affords approximately 85% protection against the monkeypox. And this is why they feel that maybe the monkeypox virus has become an outbreak, is because worldwide the smallpox vaccine is just not distributed anymore like it used to be. It is also recommended that individuals exposed to monkeypox be vaccinated with the smallpox vaccine up to 14 days post-exposure, but I'll go into that in the next slide. So currently, the Janus vaccine protects against smallpox and monkeypox. It can help reduce symptoms even if taken after exposure. This is a 2-dose vaccine, and let me go into that in the next slide. Let me go into that in a few more slides. So let's go over who should get vaccinated. First, you should be vaccinated if you've been identified as a close contact with anyone with monkeypox. Along with that, if you've had sexual partners in the last 2 weeks who've been diagnosed with monkeypox. Additionally, people who were considered high risk are people who have multiple sex partners, either engaging in group sex or commercial sex at commercial venues, such as sex clubs or bathhouses, or sex at events such as countries where there's a lot of monkeypox known to be transmitted. So like I mentioned, there are 2 vaccines. One is the Janus vaccine, which is approved in the US. It can be used as a pre-exposure vaccine given in 2 doses, 28 days apart, and you are considered protected against monkeypox 14 days after your 2nd dose. It's important to know that once you get the Janus vaccine, the COVID vaccine should be delayed for 4 weeks after the Janus vaccine is administered. The second vaccine is the ACAM2000 vaccine. This is not prevalent in the US. It is a live vaccine, which means that it can spread to others, and it can spread if the wounds that the vaccine produces are not well healed. This vaccine is a bit tricky. You need to have multiple skin pricks, and you need a specialized needle and special training to administer. So even though this vaccine is a single dose, it comes with some complications, and the side effects for this vaccine are more common than the Janus vaccine. And these side effects include fever, fatigue, tiredness, headache, and muscle aches. Also, people who are immune suppressed or have HIV, people who are pregnant, who are breastfeeding, have certain heart or skin conditions, or eye disease who are on steroids should not get this live vaccine. Along with that, people who need other live vaccines such as MMR or chickenpox cannot get this vaccine concomitantly. So as I mentioned, there's really no specific treatment for monkeypox. There is a medication called tecovirimat or TPOXX, and it's really recommended for people who are likely to get severely ill from monkeypox, such as weakened immune systems or young children decreased below the age of 8. TPOXX is an antiviral medication approved for smallpox, but it is now being used for monkeypox. Data are not available on the effectiveness of TPOXX in treating monkeypox infections in people, but studies using a variety of animal species have shown that TPOXX is effective in treating infections caused by orthopox viruses. The CDC has expanded access protocol to use TPOXX in compassionate use settings. There are other instances of medications such as cidofovir, brincidofovir, which have been reserved for CMV, but these are complicated medications, as you know, and they come with a lot of side effects. And right now, I'm not aware of many doctors using these medications in the US. Additionally, if you've been exposed to someone with monkeypox, you can get post-exposure prophylaxis, but it's important to administer this vaccine within 4 days of exposure. And if you already start having the symptoms of monkeypox, it's too late to get this vaccine. So the window of post-exposure is really short and it's only 4 days. So a better tactic is actually to prevent getting the infection in the first place or get vaccinated for monkeypox. So just want to end on some myths and misconceptions. You know, there are troubling misinformation as well as stigmas developing, not only in the US, but worldwide. I have some friends who are in the LGBT community, and they've stated that while the information on getting and the access to get the vaccine is readily available, they're being stigmatized for getting the vaccine as well because they're viewed as being highly promiscuous. So all these things make it really difficult to control the infection. And while it looks like the infection is being controlled in the US, it sounds like it is still rampant and becoming a problem in other countries. So of note, monkeypox shares very little in common with SARS-CoV-2. It's not a new or novel virus. It is not spread by respiratory or airborne transmission. And the vaccine has been in use for years and is already available, but albeit in very limited quantities. There's a longer period of incubation or infectivity. It can take up to 12 days to show symptoms, whereas COVID can traditionally in the newer variant, show symptoms within 3 days. And there's no documentation of asymptomatic spread at this point. There's no preemptive testing either. If you've been exposed, the best bet is to get the vaccine before you start having symptoms. And it's important to identify individuals who are most at risk. And these are people who have multiple sexual partners, but also anyone who is heterosexual or has contact with someone with the monkeypox can get the infection. So as we know, the most recent outbreak started in Africa and has spread elsewhere, but it is thought that this infection actually has been present outside of the African continent for some time. And while the current outbreak has overwhelmingly affected gay and bisexual men, as I keep mentioning, no one is immune and everyone should be vigilant about being safe from this infection. So I just wanted to end with that, and thank you very much for having me here.
Thank you so much, Dr. Prachi. And, you know, I'm just going to, for time's sake, I'm going to go quickly into the next presentation or speech that's going to be given to us by Professor Ogoina. Professor Ogoina, over to you. I think you need to put it in, yeah, the PowerPoint mode, presentation mode. Yeah, there. Perfect. You're still muted.
Hello.
Great, we can hear you now.
I said initially I did not want to make a slide presentation, but to speak to the issues. But since everybody is making a presentation, let me proceed with that. I'll just give an overview of the clinical presentation and treatment of monkeypox in Nigeria. All right, we're all familiar with monkeypox, the and what the case fatality associated with all the class. I don't want to, I think some of the speakers have already discussed this, so just go to the next one. Transmission, I think we're familiar with the transmission. It could be from animals to humans, it could be human to human, and also environment to human. So the speakers have also discussed this. I don't want to repeat that. Let me just briefly go through the pathogenesis of monkeypox, which is related to the clinical features. The route of transmission classically has been thought to be respiratory route, the GIT and the skin. And following the infection, that's the portal of entry. Following the infection, it goes to the blood, and there is a primary viremia. Then it goes to the lymphatics and reticular endothelial system. And then there's a secondary viremia, which there's seeding of the virus to the skin, which accounts for the skin lesions. and also some of the complications that are seen in cases of monkeypox. The time from first exposure to the first clinical symptom is regarded as the incubation period of monkeypox. Just to give us an overview of the monkeypox clinical outcome as sequelae, just a theoretical overview. Following an acute infection, there is an innate immune response to the virus. And that innate immune response, also there's also an humoral immune response to the virus and the cellular immune response that would last for a longer time. Then after a period of 2 to 4 weeks, if depending, sometimes those that have complications may recover after 4 weeks. There's recovery, and they recover with skin sequelae, mainly pox scars, and maybe also hyperpigmentation or hypopigmentation. So the duration of immunity is, of course, is not known now, and we're not too sure about the relapse or reinfection in the setting of monkeypox. So this is just to give us an overview of the spectrum of presentation of monkeypox and just to emphasize some aspects. Following exposure, 3 things can happen. First, there could be symptomatic infection or asymptomatic infection. And let me state that asymptomatic infection did not just start in the 2022 outbreak. If you look at historically the records, there have been reports of subclinical or asymptomatic infection in 80 to 30% of cases, even from reports from the DRC, extensive review that have been done from DRC. Symptomatic infection can also be categorized into two groups. There's a quasi-symptomatic and the obvious symptomatic, because some patients present with symptoms that are not very obvious. The symptomatic presentation has various categories. The pre-eruptive stage, or otherwise called the invasive stage, is the stage in which you have prodromal symptoms. And these prodromal symptoms will include fever, headache, malaise, body pains, lymphadenopathy, and the others. Then after this period, after 3 to 5 days, patients usually develop a rash, which is the eruptive stage. And the rash can be in various sites. Commonly, from outbreaks prior to the 2022 outbreak, most of the rash prominent sites is in the face, and it has a centrifugal distribution. And what the various sites of the rash are described here, and the types of rash that could occur also described here. Then patients may progress to have complications, and there are varying complications that can be seen. The secondary bacterial infection of the skin, bronchopneumonia,